And we're calling Paul, who is my brother-in-law, he's the $1 million plus man. Because I'm sure that if these interventions had happened down here, I mean, he would be ruined, and probably a good part of his family would be ruined as well. And so the question that you have to ask is, what is the cost of human life? When do we say that enough is enough? And does a civilized society make that kind of a determination? For us in Canada, for me, publicly funded healthcare, which is what we're calling single payer down here, is a normal way of life. It is absolutely fantastic that we don't have to ask the question, that we don't have to sit back and say, you get it, but you don't. We all get it. And we so get it, because this card is the only card that I really need in my wallet. It is the card that says that no matter what happens to me, I'm going to be covered. It's not about Americans who have insurance. It shouldn't be about Americans who have jobs. It shouldn't be about Americans who have money. Because in Canada, it's not about privileged Canadians or insured Canadians. It should be about all Americans having access to something that should be a fundamental right. A civilized society, I think, should not have to force these kinds of decisions on people. So, the P for profit in healthcare that's going on down here, back in the 60s, they decided that they would take it out. Now, don't get me wrong, there's a huge lobbying movement that actually came up from the States because the companies do want to come up to Canada and they do want to help privatize, move the privatization agenda forward. We have to fight it. But we know that it's a fight that we'll win. But they do try all the time. One of the things that they do is they try to tell people down here that Canadians are really upset with the healthcare. And that's why I wanted to tell you a bit of the story, the personal story. We hear the personal stories, but it really hits home when you know that no matter what your name is, no matter who you are, if you need the care, you're going to get it. And that's so important. So the P for profit in healthcare has to be replaced with the H, which is the H for hope. I think that what Americans more and more, especially in light of the last year or so, as you're going into a real economic crisis here, where everybody is coming home in a real big way, that you could be the next person who loses it. You could be the next person who doesn't have the privilege. It could happen to anyone in this room. So let's put the H for hope back into healthcare. And I think that what probably has to happen is you have to go back into your communities, each and every community. People have to listen and to hear that the whole discourse about, well, we've got a hybrid system where we're going to keep what we have, but we're going to introduce the opportunity for people to go into Medicare. You know, you have to go one step higher than that. It's easy to say, it's not as easy to do. But if you go into a hybrid system where you have some of user pay and those who have insurance, and then you're allowing people to latch on to sign on to Medicare, you have what you call a two-tier system. You know, it's not going to work as well. First of all, you need standards. If you've got people, for example, in Alabama, who have one system, and then over in another state, they'll have another system. This is a problem, all right? And because you start getting into the dilemma that Canada almost could have gotten into if Saskatchewan had gone for a system, and then Ontario had gone for a system, and then New Brunswick would have gone for another system. Different levels of care, different ways of approaching it. Especially today, there should be one standard for all. You've got much too much mobility throughout society, okay? Where you don't want people also to be moving to the state that has the better health care. So that's why when we talk about a National Health Care Act that was passed in Canada, it had foresight. It was a very intelligent way of approaching the situation. The same standard of health care for everyone. You've got the system in place. Your hospitals are in place, your clinics are in place. The only thing that you don't have in place, the only thing that's really creating the problem is how do you pay? Who pays? Okay? I think that as far as paying is concerned, and this refers back to a point that I made earlier about public services being delivered efficiently and effectively. I do believe that when the will is there and when the leadership is there, public services can be dispensed effectively and efficiently. The biggest problem with the economic crisis right now is not so much the efficiency and the effectiveness of delivering services in the private sector. It's simply that when does profit become too much profit? When does the drive for profit actually start to